going forward in diabetes management, we're starting to understand that blood sugars vary over the day. And good blood sugar control is really about kind of overall control. And so what are you before a meal? What are you 2 hours after a meal? What happens during the day? And the science on managing diabetes glucose levels is really helping us with this concept of time and range. So this is something that if you're not familiar with now, over the next few years, you will become quite familiar with this term. It's something that the clinicians are really finding that's actually really, really important. And so this really would require a lot of readings, right? So, you know, you'd kind of have to be a little bit of like a detective, right? So when are your sugars at their highest, and how high are they? And when are your sugars at the lowest, and how low are they? And okay, so maybe we could have a look at when you go really high and see what we can do. But this requires us to let go of the judgment. And if we do that and just look at blood glucose results as just feedback, then this offers a huge potential that I'd like to show you. Psychologists are familiar with something called biofeedback. Biofeedback is when you are able to track what's happening, and that allows you to do something about it. So you can see in this picture here, this is biofeedback. And so this is the person that's looking at how much tension is in their forehead and how much blood flow is going through their fingers. And they're actually able to control those by using biofeedback. So feeding back your biology and allows you to make changes. And the speedometer example fits perfectly to that. The second advantage that we have is technology. And so let me show you what I mean by that. I don't want to make this sort of a boring data presentation, but I just want to make the point that using apps, using technology in diabetes has been shown to be helpful. And so this is just a series of research studies that kind of bring all the results together. And what you see there is that this, in multiple studies, using these apps has been shown to be helpful and improve diabetes control. So again, here is another indication that mobile health apps have been actually really useful. This is looking at fruits and vegetables, physical activity, weight outcomes, showing that apps are helpful. So I'm just trying to show you that the technology is sort of sitting there. And if we combine it with this idea of self-management, adherence, and taking control over blood glucose as if it was just neutral feedback, we can really benefit from this. As well, when we look at our logbooks, they're kind of messy. They're kind of challenging. And if you've ever been, you know, in a situation where you're trying to make sense of what's gone on in the last number of months and weeks, it can actually be a real challenging activity for us to do. And so much so that we've actually seen that there can be some problems with the current way that we've been tracking our glucose levels. And what we hear from clinicians is that it's not easy to manage all of the data coming in. It's time consuming. What happens if you forget your logbook? Confidence in the sort of reporting can be sort of challenging. So currently, this isn't a really, people aren't highly satisfied, neither the individuals or the clinicians. And research actually confirms this, where we're seeing some papers saying that sometimes the record book isn't as accurate, and it becomes actually challenging and problematic to work with. And so what are we going to do about this? And we have a really, really great opportunity to capitalize on what technology has already been developed. And I'd like to sort of finish this presentation off and then take some questions by really illustrating how we can go forward with this. So here's an example of how you use technology. This is the OneTouch reveal system that would actually take those records. So think about that record book, which you had seen, and how do you make sense of that? And then look at this. I mean, this is a way of presenting it back to you where the reds are high, the greens are in range, the blues are low. So all of a sudden you can see very, very quickly what's happening. And this is work that's done by the technology in the background. And, you know, this can be really, really useful because it does a lot of that pattern recognition. It can also be there to kind of help give you immediate feedback. So, right, red is you're driving too fast. So, hey, maybe what do you need to do to take the foot off the gas? Blue is you're driving too slow. Hey, what do you do to push the gas down? And if we'd use that same metaphor, whereas now, how do we make sense out of this? How do you say, okay, well, you've been actually high X% of the time and low? It would take us, you know, 35 minutes somehow doing some kind of complicated math to be able to figure that out. And I defy any of us to actually be able to do that. So again, we know that this technology is so helpful because it can really address patterns. It can look at overall trends, and you can see in this system how you can take this information. So on the top, it's sort of a nice little summary, but let's say you wanted to dig down. Let's say you found this very helpful because it kind of gives you, here's my average, and I can see where I am most of the time. And then you go into your clinic and maybe they want to dig deeper. And if you look at the bottom, you can see the option of digging deeper. And so what I think is really interesting, now that you're home, now that you're feeling that, you know, it's kind of falling to you to figure out how to get out of this, these are some really useful strategies that you can think about as a way of moving forward. And it's really just technologies there for you. And is it convenient? You know, and does it provide the supports that you need? And we know that there are, you know, some technologies are better than others because they can really feed you information that's really, really valuable. And you can see some examples of ways that we you know, use our technology, and we have some real opportunities to do this in diabetes. And we actually know that it's helpful. Again, I don't want to bore you with data, but this is an initial pilot study done in 2008, taking these kinds of technologies and seeing, can they help? So when you actually incorporate these sorts of meters and use the feedbacks, what do you get from that? And here's what you get from that. And if you just, again, if you look at those bars, what that shows you is the control. So those are the people that didn't use the system. And their control, their reduction in A1C, so the improvement, so lower your A1C is better, went down by 0.7. But those that used it went down by 2%. That's just huge. The difference between that is 1.3%. So that's a pilot study. And here's a follow-up study that involved a lot more people, was done a lot more rigorously. And what did they find? The same thing. So again, you see that same result that we saw before, which is a very significant increase in control associated with the use of these systems. And so let me just end my presentation by illustrating the potential that we have. And, you know, these are great, but how do they translate into practice? So what could you do right now? And I'm just going to illustrate this through the OneTouch system. The VERIO Reflect is actually in a way, a smart meter, because what it does is it not only collects the information, but it organizes the information in a way that could provide you with some guidance. And so you can see here, you sort of take a blood glucose reading, it's kind of low, and then it has some advice here to sort of treat the low. It can provide some impact. It can tell you, okay, it's found a pattern, and is that something that you'd like to look a little bit? And it also has the ability to kind of provide some encouragement, because then it can aggregate and help you to sort of get that feedback. And what I love about these kinds of technologies is that work all happens in the background. So it's not like you have to do all that work. You're working hard enough as it is. And if we can begin to leverage technology so that it can take advantage of the work that you do, then it's sort of, you end up working smarter, not harder. And I think that's really where the important outcomes can be. The other potential is to really take the meter and really connect it to your phone, connect it to your clinicians. And so one of the really nice things about this is that it connects to this mobile app, and the mobile app will allow you to really dig down. And so when you're interested, it's there for you to tap into. So you don't have to do it every day, but if you have a question, and this is what I really like about diabetes self-management, it's not that you're supposed to do all this stuff because the self-management behavior is there to answer your questions. Are you high? Find out. Are you low? You can find out. Why are you high? You can find out. What could you do that would be different? Well, you can try some things and find out how it works. And so what we're doing is trying to create this curiosity in a way that allows you to be empowered. And so we don't want you to become a mathematician in order to figure out how to do this, and technology can really support us in this regard. And it also allows you to connect. So when you go in, imagine going into a clinician with a record book, and then the clinician is sitting down and looking at, I don't know, 65 numbers and trying to make sense of that. Wouldn't it make sense if you could send that information to your clinician so that they could have it in advance? And that information can be coded and it can be charted, and it really will support and improve our ability to move forward. And it allows this summary. And so again, you can see these two results. And so this is kind of a mock example of where you've got 2 periods of time, you've got a total number of readings, you've got percentages that are in either too low or too high or in the right range. And it's just feedback. Again, think of it as the speedometer. It's not judgment. It's not good. It's not bad. It just is. And if you're not satisfied, well then, okay, you can have choices. And you can use and get information in a way that really works for you. And so this presentation has really been trying to support you in going forward. And my hope is that I've sort of been able to touch on some of the current situation that you might find yourself in, help with strategies for reducing the stress that you're under. And then the encouraging piece is to really reflect and say, can this pandemic become an opportunity really for improvement? And that improvement could really be around the self-management, the personal responsibility